All right, so our topic for our presentation is mental health issues in athletics. My name is Chris Nieves. I'm an athletic trainer here at Northwell. I actually have a background in sports psychology. I actually have a master's degree in sports psychology, so I'm kind of aware of some of these mental health issues that are often facing the athletes that we work with. In this presentation, I have no disclosures to claim, and yeah.
I'm Dr. Goodwillie. I'm part of the sports medicine team at Northwell Health. I'm a sports medicine orthopedist based out of 611. This particular topic is very important to me, and I'm glad that we get an opportunity to present. And I also do not have any disclosures.
There you go. Okay. All right. So we're first going to define what mental illness is. So according to the CDC, mental illness is a condition that affects your thinking, mood, behavior. It's something that can be chronic, so you can deal with it your entire life, or it's something that can just be short-lasting, that different events may trigger it. It's something that a lot of Americans face. 44.6 million Americans currently live with a mental illness, and 1 in 5 adults experience mental health illness each year. And those people that deal with mental illness are more likely to develop other kind of health conditions, such as cardiovascular and metabolic diseases. So mental health can really have a big impact on your entire health. All right, so now we're just kind of talk about how it's in children and in young people. Mental illness is very common amongst adolescents and young people. Kind of our demographic that we work with, especially as athletic trainers, in the high school level, also in the collegiate level. The rate of mental illness is twice as high for those in 18 to 25 as it is in those 50 years and older. And nearly half of American youth struggle with a mental illness before turning 18. While 12% have experienced a bout of depression. And most teenagers in the US do see mental illness as a major issue amongst their peers and something that's been actually growing and getting worse. So it's something that's definitely affecting a lot of our young people today. All right, now we're going to talk about mental health in athletes. So, mostly our population that we deal with. So we know that it's also not only increasing in youth and young people, but it's also kind of increasing at the high school and collegiate level as well, where we're seeing athletes struggling with mental health issues and just having more, whether it be negative emotional states than non-athletes. So it's something that has been growing. According to a study done at Drexel and Keene universities, 25% of collegiate athletes have reported clinically relevant levels of depressive symptoms, and 35% of elite athletes have also suffered from a mental health crisis, which may manifest as stress, eating disorders, burnout, or depression or anxiety. So athletes are not immune from this issue.
Yeah, I think this is important because participation in athletics is really typically being seen as favorable, right? It has the ability to improve mood, improve self-esteem, awareness, teamwork, confidence, etc. But there is a cost to it potentially, and that extremes of participation can lead to these increased levels of stress, burnout, depression. And this can be especially true with our elite athletes, which are not necessarily immune. And as Chris mentions here, up to a third of elite athletes can be affected. And we know that depressive symptoms correlate with performance failure, and we're going to touch on this a little later in our talk. And it does seem that our elite athletes tend to be a greater risk for depression than our less elite athletes.
All right. So we know that athletes, might be at greater risk because they're less likely to seek treatment. They may be afraid, right, to tell someone that they're having these symptoms, and they may also view counseling as a sign of weakness. So we know a lot of times that athletes are not really getting the help that they need. They also kind of come from the mentality of kind of working through pain, or may have like a sense of entitlement that that they can get through this. But sometimes they're just not, and that's where they kind of need people to help them. So we know that 85% of athletic trainers indicate that anxiety disorders affected their student athletes. So it's something that athletic trainers see. This is something that athletic trainers notice about their athletes, that they're having these symptoms, and they're good, and something's not right, and they need us athletic trainers to kind of maybe step in that moment and make an intervention and really be there for our athletes.
Yeah, and I think that's a big difference with the physicians or the team physicians. As we employ kind of a team approach to our student athletes, we rely on our athletic trainers and our coaches and the staff that see our athletes every day to report these types of issues to to the medical team and to the physicians, because in our clinical practices, it's very hard to pick up on cues that athletes may be struggling with mental health issues, because we typically get very bogged down in the relevance of their injury and their recovery and how it's going. And we don't typically discuss this as in an open sense, in an open forum. And there's ways that we as physicians can become more integral in the diagnosis and treatment of mental health conditions. And Chris will discuss that a little later in our discussion here.
All right. So these are just some causes of mental health illness in athletics. So the first one is stress. Being around athletes, we should all know that athletes are very stressed, right? Not only with demands placed on, their sport, but also the academic demands. And sometimes that being able to balance both academic demands with athletic demands can be very stressful for an athlete. So we know that's a cause of mental illness. Another cause is the professionalization of youth sports. So youth athletes are kind of getting groomed to play, professionally by coaches, by parents. They're under pressure that they have to perform a certain way. They have to get that college scholarship, right? And that pressure that they deal with can lead to exhaustion, to overtraining, which also increase the risk of mental illness. Sleep deprivation is another cause, and that's something that a lot of college athletes struggle with, is having sufficient sleep and having a good quality sleep. And that's also been shown to link to mental illness. And then specialization in a single sport also is within this realm of where athletes are just focused on one sport. And, if they're focused on one sport only, they're more likely to get injured, right? They're more likely to get injured, which could trigger a mental illness as well.
Right. And I think that's the key, Chris, right? Is that that with the athletes that we're dealing with, or particularly on the orthopedic side of things, is that athletic injury can really be problematic and really elicit a psychological response in athletes, which can oftentimes be negative.
Mm-hmm. All right. So these are just some triggers of mental health illness that you can see, poor performance, conflicts with coaches and injury, class concerns, playing time, changes in, the importance of sport. So pressure, as we spoke about, lack of sleep, alcohol or drug abuse, gambling problems. So these are things that sometimes we may not see as sports medicine professionals, right? We may not know what they're doing outside of their sport. But sometimes they might, events like this, could be things that can affect their mental health, which could be, which could affect when we're working with our athletes. So it's always good to kind of have a broad sense of some of the things that might not be going on that might still be affecting our athletes' mental health.
Yeah, and I think it's also very important here to recognize that a lot of these triggers are psychological and sociocultural factors that can really potentially independently increase our athletes for risk of athletic injury, and therefore may place our athletes at a risk of poorer recovery, which in and of itself can trigger more mental health issues. There are unfortunately very limited prospective data looking at these triggers, but as we're suggesting here, stress is consistently demonstrating a relationship with injury risk and inability to recover from injury, and ultimately trigger mental health issues in our athletes.
All right. So these are some obstacles that are surrounding, the mental health care, that is provided to athletes. The first obstacle is that a lot of times athletes are hesitant, right? Athletes, are not always the first one to say, hey, there's a problem, I need help with my mental health. So athletes are very hesitant to receive care, and they're less likely to receive care than non-athletes. Seeking mental health care, not only in sports, but in our society, still kind of remains a stigma, right? Something that people are kind of scared about telling another person. For athletes, they may consider seeking help as weakness, right? Feeling that they could push through, like if it's an injury or something. So sometimes they feel it's a sign of weakness. What is my coach going to think? What are other people going to think if they see me asking for help? And then finally, it's a false notion that athletes are immune from mental illness. That's something that maybe people might believe, whether it be parents of athletes or even coaches, that that athletes don't deal with mental health issues. That's for non-athletes, and that's not true. Athletes are just as likely, if not more likely, to have mental health issues. So a lot of these are just obstacles that sometimes can really negatively impact athletes getting the care that they need.
Yeah, I think this also touches upon the debate on stereotypical athletic personalities that may be conducive to more success in or failure in sport. And it has been shown that athletes tend to show more positive characteristic traits, extroversion, less anger than non-athletes. But it's unknown and inconsistent as to whether this kind of stereotypical athletic person or personality traits can really predict success or failure in athletics. We also know that athletes, especially adolescent athletes that have this kind of high mental toughness, tend to be more resilient to these stresses and report less depressive symptoms, and therefore carry a lower rate of injury. And athletes that have a higher resilience also tend to effectively or have more effective ways and better coping strategies with particular stresses. And this is known throughout life as we know it. In boardrooms in the financial sector, if you have more resilience, you tend to have better coping strategies. So I think with this slide, we also have to realize that each of our athletes are independent. They really need to be considered unique. And even that strong-willed, independent, resilient athletes certainly may not be immune from mental health issues.
All right, so anxiety is the most prevalent mental health issue facing athletes. So any anxiety disorder can be sports related or performance anxiety, also known as performance anxiety. So it's something that's directly related to their sport, or could be from an underlying medical condition where they are just generally an anxious person. So there's some different types. So the most common type is a generalized anxiety disorder. With some other disorders that fall under anxiety are panic disorder, obsessive compulsive disorder, and a phobia. So these are all the anxiety disorders. Some signs and symptoms are, feeling apprehensive, feeling powerless, having a sense of impending danger or panic. Someone who has an increased heart rate, impaired concentration, change in appetite, breathing rapidly. These are things that athletic trainers might notice, right? Might notice on the sideline, might identify some of these signs and symptoms in our athletes. We know that anxiety can lead to a decrease in performance, because when you're anxious, you're not focusing on what you need to do. You are distracted and focused on other things, and being distracted and not being fully focused, that's going to negatively influence your athletic performance.
Yeah, and to bring it back again to athletic injury, right? Anxiety will play a significant role with injury patterns, right? The loss of time, the time away from their colleagues, the inability to exercise. So it plays a role in psychosocial factors that can, again, influence outcomes in sports injury and rehabilitation, and can be very problematic in athletes' cognitive, emotional, and behavioral responses to injury. So injury can cause anxiety disorders and can bring this out and unearth them in some way. And we know that athletes that have had more severe past injuries and surgery tend to have more anxiety disorders. And that's true in our current athletes as well as former athletes.
All right, so depression is another, is the second most common mental health issue that's faced by athletes. 1 out of 5 athletes report depressive symptoms. So it's very, very common in athletes. Some signs and symptoms include, lower sad moods, crying episodes, being irritable or angry, feeling worthless, having eating or sleeping disturbances, just kind of being lethargic and not having energy. Could see decreases in concentration, suicidal withdrawal, negative thinking, or thoughts of death or suicide. So these are, things that, could be red flags. If you have an athlete who isn't normally, somebody who's very maybe upbeat, somebody who's maybe very extroverted, right? You see them all of a sudden maybe following an injury, showing some of these signs and symptoms. They could be dealing with a bout of depression. So like I said, it's important to be able to identify these signs and symptoms.
Yeah, this is a significant issue, and I think in our practice we see, or depression sees us more than we see it, unfortunately. And again, reliance on this team approach to pick up on these red flags, as Chris is talking about, and some of these signs and symptoms. And this is a significant issue. I think female athletes are up to almost twice as likely to report clinical depressive symptoms than their male counterparts, and And I believe that younger classmen, freshmen in particular, are more likely to report some of these signs and symptoms of depression than their upperclassmen. But I don't think we should think of this as a male-female problem, because there have been studies to suggest that up to a third of Division I football players report high levels of depressive symptoms. And I think it's important to also note here that a lot of these symptoms are consistent also with abuse and substance abuse, especially alcohol abuse in our collegiate athletes. And if you look at suicide in particular, there was one study that shows that suicide, individuals that have actually completed suicide, common correlating factors include successes prior to their injury, serious injury requiring surgery, and a lengthy time away from sport. So the greatest predictor for suicide is unfortunately severity of injury. So coming back to a clinical perspective, when we see athletes with major catastrophic injuries that are going to take them out for a significant period of time, I think thinking about these symptoms and trying to pick up on any red flags is extremely important.
All right, so eating disorders is another mental health issue that's facing athletes. So we know athletes are at risk for developing eating disorder, especially those that play sports that kind of have a focus on the athlete's diet or their appearance or their size. So like wrestling, rowing, gymnastics, dance, track and field. The two most common types are anorexia nervosa and bulimia. They can be found in males and females. So female athletes tend to be more at risk. 1/3 of college female athletes report attitudes and symptoms of anorexia nervosa. So like I said, it tends to be more on the female side, but males can also develop it as well. All right, so anorexia nervosa. So this is characterized by restricting what you're eating, and it leads to a low body weight. And the person that has this often has a distorted body image, thinking that they are fat or they're overweight, and kind of, that's causing them not to eat food. So some signs and symptoms include extreme thinness, someone who's maybe obsessed with being thin and not eat, and can't eat this, can't eat that. So they have an intense fear of gaining weight. They have this distorted body image, lack of menstruation among girls and females. So it's something that can have other health impacts as well. So a lot of it is restricted eating and also compulsive exercise. They may also engage in that as well. So bulimia, that's also a common one. So that's characterized by binging on large amounts of food, so eating a lot of food and then vomiting it up. Using laxatives, that's often a red flag, that if you hear an athlete that's, constantly maybe using diet pills or laxatives, that they could, that's definitely something to inquire more about, because that's often a sign of it, that they're using these pills. But some signs and symptoms that you might see is, someone always has a sore throat, swollen salivary glands, they're having wear and tear in their teeth, acid reflux, so they may have some gastrointestinal issues, severe dehydration, having an electrolyte imbalance. So these are just some signs and symptoms to be aware about. So mental health and COVID. So with coronavirus, that's been affecting our nation and the world. It's definitely caused a lot of uncertainty for everyone in athletics, for athletic trainers, for physicians, for athletes, for coaches, for everybody. It's kind of thrown us for a loop a little bit. But during this pandemic, a lot of athletes have reported high rates of mental distress, such as sleep disturbances, feeling depressed, a sense of loss. That was actually done by the NCAA in a recent study. And it's also affecting high school athletes. They've been reporting increased levels of anxiety and depression due to the cancellation of sports. So we know that athletes and also non-athletes are just exercising less, right? With things being closed, not having gym class, that has also decreased. And we know that a lot of times athletes and also non-athletes use physical activity as a coping mechanism, right, to deal with stress, and with them not be able to do that, that kind of takes that coping mechanism away, and it can cause other stress as well.
Yeah, I think this is the great unknown, right? This COVID-19, and it's thrown our sports medicine world into a tailspin. So in the office, we're already seeing it on the physician side, that athletes are coming in more often looking at chronic injuries and potentially taking care of chronic injuries during this particular season, as there is such a big unknown. So it is affecting our team in many ways that maybe were predictable or weren't predictable.
Mm-hmm. So injury recovery and mental health. So we know, being injured, as we all see when we're working with our athletes, can cause emotional stress, right? Being out for a certain period of time, whether you have to get, additional like surgery. So the whole injury process and the recovery can be very stressful. How an athlete responds to an injury will differ. So we should treat each athlete as an individual and not assume that they would respond a certain way, because how everyone responds is different. Sometimes an injury can kind of trigger different mental health issues that we mentioned already. So a lot of times when athletes get injured, especially if it's a career-ending injury, it can really affect them, a lot, because if they don't have like an identity outside of sports, it can cause a stress in that way. The athlete starts thinking, what am I going to do if I can't play my sport? So athletes who experience negative thoughts are more likely to have decreased rehab adherence. And they're more likely to have to not perform as well after they recover. So having a very negative mindset and dealing with these mental health issues can really have ramifications, even when they're healthy. So we know that exercising and participating in sports is often a coping mechanism. So when you take that away from an athlete, that's when they can feel a lot of the stress, and it could just negatively influence their mental health. All right, so injury recovery, mental health. So there's a normal reaction after someone sustains an injury, that includes processing, right? Processing what their diagnosis is, what's going to be the treatment, or what's the protocol for managing that injury. So the normal response to an injury often includes, being sad, being, a little isolated, maybe a little irritated or lack of motivation, a little anger, frustration, and also seeing sometimes some sleep disturbances, right? You can't sleep because you're worried about your injury. So some problematic emotional responses. So this is just a nice table that shows how symptoms can kind of, get worse, right? Where someone has kind of some sleep issues and irritability, but then it kind of goes into other things where maybe they get into disordered eating. They may be having more of, lack of motivation. They don't want to engage with anybody else. And then where it becomes excessive, when, it can lead to just excessive anger, a lot of emotional outbursts, and can lead to substance abuse. So this is kind of how emotional responses can kind of take a toll for the works and how they could change.
Yeah, I think this is very tricky, right, Chris? It's the what's normal and what's abnormal, and how do we best kind of distinguish the two, right? You're going to have a normal response to injury, but when does it become problematic? So knowing your patient and understanding your athlete and how they typically cope with minor bumps in the road along the either athletic career, and how they change into some more of these problematic emotional responses. And again, just that last issue about substance abuse is that self-medication can be very common in athletes that are undergoing injury. So that may be a telltale sign that something's going on. But like Chris says, that it can be somewhat difficult to understand what's normal versus abnormal. But again, that speaks to the team approach, which we're going to touch on next.
Mm-hmm. So to manage these mental health issues, you kind of broke it down to three main points. Is the first thing to manage mental health issues is to be aware of them, right? To recognize the signs and symptoms of various mental health conditions. That's the first one. As athletic trainers, we see our athletes on a regular basis. So to be able to identify anything that seems abnormal for the person, that's really our responsibility, is to be able to identify and recognize these signs and symptoms. The next point is having a mental health management plan. That if something does happen, or if we see an athlete that does need further mental health examination, we already have a process in place, right? A referral mechanism of who we're going to tell, who's going to be part of that. The mental health resources available obviously are going to be different. If you're in high school versus if you're in a college, right? The college setting typically, has more counselors available and stuff like that. Whereas in the working with a high school, it's more going through the parent, right? It's a little bit different since they are minors that we're working with. But you have to understand who's part of that team. As Dr. Goodwillie said, having a team approach is really the best approach to have many people that are part of that team. Finally, serve as support and serve as an advocate for the athlete throughout. As athletic trainers, we may refer them somewhere. They may be seeing another another medical professional, but as athletic trainers, we still should be supporting our athlete and still checking in with our athlete and making sure that they're getting the help that they receive, and just being an advocate and just supporting them through the entire process.
I'd maybe add into this, Chris, that, as part of the healthcare team, we also have to understand some of the barriers that we've discussed before, and understand how that can potentially negatively affect athletes coming in to seek care. So understanding, these potential issues is key to being able to manage them effectively.
Mm-hmm. All right, so here's some other kind of considerations to keep in mind when you're managing an injury-related mental health condition. Is you want to, of course, as we mentioned, understand the common and problematic psychological responses to injury, right? So as we mentioned, looking at that table, being able to identify different signs and symptoms. You want to build trust and rapport with injured athletes. So, injured athletes, like I said, could be struggling with, finding their identity, and could be having trouble processing their injury. So as athletic trainers and physicians, we want to be able to build some kind of trust and rapport with the athlete. We also want to educate them, right? Educating them on the different emotional reactions to what they feel might be normal and then what isn't normal. We want to keep them active in their rehab and rehabilitation. So we want to keep them positive. We can teach them different coping skills such as goal setting, visualization, thought stoppage. So some of the mental skills can really be beneficial for athletes. So we want to keep them, motivated, keep them part of their team, right? Keeping them to, participating in team events, maybe going to games if they're able to, and just part of the team, because that also can be very helpful as well. All right, so some strategies. These are some strategies in managing mental health illness in athletics. So the first thing that that research really shows is having a mental health screening. That being able to screen for these mental health issues can be very important and can really be used to help identify mental health conditions in athletes. So I'm going to show you an example of two that are often used. The next part is to educate, right? Especially as athletic trainers, we should be educating our athletes on different signs and symptoms, and not just to our athletes, to our coaches, to the parents, to anyone really working with athletes, and tell them about, things to keep up, to look for, and just benefits for seeking help. Having a mental health management action plan, like I mentioned, that's definitely something that we should have. That athletic trainers and different athletic departments should have a policy that if somebody has a mental health condition, we know what to do. Manage the confidentiality of athletes, right? That's important, especially if you're on the college level. You want to make sure you're really doing that and working with the athlete and keeping their trust. That's an important thing within this process. The next part is approaching the athlete, right? Sometimes as athletic trainers, I feel like we often have to do that, right? Approach the athlete, and if we hear something, the first thing you always want to make sure is you have accurate information, right? You want to have accurate information, whether it be from from the coaches, from other teammates. You want to show care, right? You want to be very empathetic to the athlete. You want to make them feel comfortable. You want to allow them to speak. So that's very important. And the conversation should always be focused on the student athlete as a person, right? Not as an athlete, just understanding them, where they're coming from. And that communication is going to be very important throughout the entire process. Again, just to build trust with the athlete and to make it a comforting environment where the athlete can be open with you and can trust you. That's the ultimate goal, is having that trust.
Yeah, that's key, Chris. Right. So the stigma is the most important perceived barrier in seeking help in young athletes, as well as the lack of mental health literacy and negative past experience to seeking help. So if they've had a bad response before when they've sought help for mental health issues, that's negatively influences them. And the opposite is true, right? So encouragement, having an established relationship with their healthcare provider, and having a positive prior experience in seeking help will all facilitate athletes to come in with these mental health issues. So education is key, right? And it's forums like this that can be very helpful.
All right. So here's a sample health screening. This is actually a recommendation from the NATA, from the National Athletic Training Association. So this is a sample health screening where you would ask these questions to an athlete, during like an examination, like during a physical, right? So this would be the screening tool. So any yes that a student athlete would write here, that should lead to a further discussion between the student athlete and the athletic trainer or the team physician. So basically, if an athlete writes yes on this, that's kind of a red flag that there definitely should be a follow-up for. And then here's another questionnaire. It's called the SCOFF Questionnaire. So this is used to assess the presence of an eating disorder. So this is something that also can be added to mental health screening. So any questions about their eating habits, if they're losing weight, things like that. Again, having a student athlete, check yes to one of these questions, again, should lead to a discussion between the student athlete and healthcare provider. So it's important. I think it's important to ask these questions and to make sure that this is being screened, because you never know. You never know. You could be identifying something already before the season starts that could lead to something much bigger. So I feel like this is another good tool to add to a mental health screening. All right, so these are some questions to ask when you're approaching an athlete. Is you want to ask them how things are going, generally. You can tell them, I've been noticing these kind of incidents. It's concerned me. What's going on? So it's asking questions where, again, it's showing that you're caring about the athlete and you've been noticing them. And you're kind of looking out for their well-being. So these are just some good questions to kind of ask the athlete, and just to kind of understand what's going on. But like I said, you always want the perception to feel that you're coming from a sense of caring for the athlete and you're looking out for them and you want to help them. So it's always important that we focus on that, not only in us asking these questions, but also in our body language, in our nonverbal communication, because these kind of be sensitive issues for an athlete. So you always want to approach it in a positive, but also a positive and professional way.
Simple yet effective questions, Chris, and I think questions that we can ask probably more than we do in the clinical setting.
Mm-hmm. All right. So in conclusion, mental health illness is a major issue facing athletes. So I think the first point is to be aware of that. So as athletic trainers, physicians, it's our role to identify any problematic symptoms and facilitate any referral to the proper mental health system, right? So we're kind of the eyes and ears, especially athletic trainers, right? The eyes and ears for a lot of these, for identifying these symptoms. It's also our role to educate, lead, and demystify the stigma surrounding mental health and make sure student athletes feel comfortable addressing any mental health concerns. So again, being open about these issues, educating others, and that's very important. So kind of promoting a culture that that student athletes are open to sharing any mental health struggles that they're going for, and really having their back and supporting them throughout the entire process.